so much for having me. The reason that we're here today is just to really educate you guys on what we can do in our life. We're going to go over a few things today that you can actually do today, starting today, is going to actually change your health going forward. And so, you guys know where we're at when it comes to our health and our culture. Right now, we're all kind of lost on where to go, especially right, there's a lot of stuff going on in the last couple of years that we all probably know about. And so one of the cool things about what we get to do with what we do in our clinic and in the community is to really equip you with not only just taking responsibility for your health, but one of the best things that we see is that when people see transformation for tomorrow, next week, next month, next year, and what's neat is that you can take this information we're going to take today, that we're going to go over today, and actually share it with people that you love and care about most, which is great, right? And who knows that the older we get, the wiser we get, right? Who knows that? The older we get, the wiser we get, right? But a lot of times what happens is that some of those old belief systems really stick with us, right? We don't want to learn too much anymore. We just think we know everything. Who knows someone like that? Anyone know someone like that? Right? No one ever puts their head down, right? And so one of the things I'm going to ask you to do today is just to really start to open up your mind to a whole new way to view your health and what things that you can do today is going to really impact your health that may be different for you, right? And so yes, I do have 3 kids. I have a 8-year-old, a 6-year-old, and a 4-year-old. And what I've noticed with children from the time that they're born to even now, my 8-year-old, is that they're learning something new every day, right? They're learning something new every day. They're learning how to crawl, they learn how to walk. And when they fall, they get what? They get what? Up, right? They get back up. They reach for things they shouldn't reach for, right? They're touching things, they're listening to things, they're turning their head, trying to figure out their environment. And so what happens is this, is that every year we start to age, or say get wiser over time, those things that we once had to learn, we stop actually utilizing over time. Would you guys agree with that? We're sitting more, right? We've heard that sound, so we're not going to turn our head and listen for it, right? We're not going to throw balls in the air and try to juggle or play baseball or softball, or maybe not play basketball anymore. But all of those things affect our nervous system, which then in turn affects our posture, which then in turn affects our ability to process our environment. Our biggest thing is we've got to figure out how do we process our environment and be sensitive to what's happening around us. Okay, so one of the things that we can do, we're going to talk about today, is focus on our posture. And we're going to focus on our posture today. Why? Is because our posture determines our brain-body connection. It's not just, hey, I look good or I look bad. Who knows someone like this? Anyone know someone like this? No one in this room. Someone like that, right? Listen, when we get to that point, when we're in that flex position and everybody sits up straight, right? We're in that flex posture. It literally puts our body into a fight or flight state. Who's ever heard of fight or flight? Right? It literally puts our body into a fight or flight state. When we're in that flex position, it's called a protective position. It's the fetal position. Some people may sleep that way, but literally it actually increases our cortisol, which is our stress hormone in our body. And when do we start to sit like that? When we have a what? Starts at a young age, the workforce. When we have a desk job. Right? Anyone have a desk job in this in the past? Right? So we're stressed at our desk, and we're also sitting in a stress posture too. So how does that work for us? Is that good or bad? It's really bad. So what happens is that we go into this flex position, this flex state, and so that it keeps our muscles, it shortens the muscles on the front of our body, right? And it weakens the muscles on the back of our body. Okay, so what happens is we got to have a good posture. So where does our posture start? There's a couple arguments here, right? But one, I believe it starts between the ears or at the eye level. Okay, the eye level and the ears. Where's your eyes and where's your ears? Okay. So one of the things we have to focus on is, are we looking down at a 15-degree bend, or are we looking up slightly at about a 10 to 15-degree bend upwards? Okay, so we should always be looking upwards at some level. Okay. Also, what we need to be doing is making sure our head is back over our shoulders. And then the next area is our shoulders have to be back and our diaphragm has to be opened up. Okay, what happens is also is when we go into a flex position or a flex state, our diaphragm actually tightens up and our lung capacity goes up or down. What do you guys think? Goes down, right? And so now we're in a shallow breathing state. Is that good or bad? Bad. Why is that bad? Let's go to the next level. Not just because it looks bad on your posture, right? Less oxygen. What does our brain need? Oxygen, right? Every single cell in our body needs oxygen. So if we're in this postural state where our diaphragm is actually shortened, or we're in a flex state, we have to work on really opening up our ribs. We cannot bring our head back over our shoulders if our ribs are tight. Does that make sense? Right, so we've got to really open up our ribs with different range of motion exercises. And then we just keep going down. And so to the abdomen region, right? Sometimes people protect their abdomen from maybe they have stomach issues, maybe they have past surgeries, maybe once again, they're in that stress physical state, maybe they're dealing with digestive issues currently or in the past and it's still affecting them to this day. Our body has these memories. And if our body doesn't get rid of these memories or start to develop a new pattern, they'll stay with us for how long? Forever, right? And so some of the things that we got to work on even in this room, and I'm still working on in my health, is things that happened to me when I was a kid, right? Or things that I dealt with physically as a kid that I've never had to deal with. Now my body's having to unwind that and change that. And until we put the work in, guess what? Change doesn't happen, right? And who knows that change doesn't always feel good? Raise your hand if you know that. Change doesn't always feel good, right? Raise your hand if you love change. Yeah, there's 5 of us in this room, right? Very few like change. Why? We are creatures of what? Habit, right? And we don't want to be caught off guard, right? We don't want to be changed. But we got to start to recognize, the first thing is before you change, you start to recognize where you are. It's the whole look at yourself in the mirror thing, right? Where's my posture? Honestly, where's my posture? What am I looking down at? Am I looking up or am I looking down? Are my shoulders back? Is my diaphragm open up? Is my abdomen not tight and stressed? And then we look at our hips, right? We see these people, whether it's here or it's at church, right? Where people try to get out of a chair. You see people get out of a chair and they stay in this flex posture for a little bit. You see somebody like that. Yeah? And it's almost like their hips will not open up, right? So what we have to focus on is even if you aren't there naturally, we got to focus on sitting up straight or standing up straight and opening up our hips. Our hips should be wide open like that, okay? And then the next pair of joints is our knees, right? You know someone with bad knees? You know someone with bad knees? And who's always blaming it on their age? Anyone blaming their knees on their age? All right, a couple people said yeah, all right. Well, the other knee's the same age, just FYI, if you guys didn't know that, right? And so if we have bad knees, that could be a postural issue too, right? And so if we're leaning forward, just that 10 to 15 pounds of pressure forward on our knees is going to cause more pressure in our knees, and therefore we start to do something called compensate, right? Compensating patterns start to develop, right? So the posture of how we walk with our knees really also determines our level of posture and, of course, our level of balance. Okay? Now, the joints that most people actually forget about unless they're in pain is our ankles and our feet. Right? So our ankles have to have good mobility, right, or flexibility in order for every other joint, I believe, to respond well. Right? So we can start to change our head all day. I think that's where it honestly starts, like I said. But until every other joint is trying consciously to go in the right direction, I think it's going to be, we're beating our head up against the wall a little bit. Okay? Now, why is posture so important? Not just so you don't fall, not just so your muscles are strong, your ligaments and tendons are activated, and not just so we're in a fight or flight state. I'm not in a fight or flight state, but because our spine has to be in a certain posture in order for our body to heal and function 100%. You know, our brain controls absolutely every single function of our body. Most of us know that. For your heart to beat right now, for your lungs to breathe, for your stomach to digest food, your brain controls it all. Everyone would agree, right? No one would disagree with that, right? You talk to the best doctors in the world, they said, yep, your brain controls everything. If the guillotine has worked for years, it's going to keep working, right? If this is not working, then the brain's not going to be able to communicate with everything, right? Now, our spine has to be in a certain posture as well in order for our brain to communicate with our body 100%. Who's ever heard of scoliosis before? Have you ever heard of scoliosis? Do you guys remember when getting checked out for scoliosis as a kid? At least when I was a kid, they checked you out in gym class, right? You go to gym one day, and the PE teacher checks you out for scoliosis. Your grandkids may have been there and done that. And so what happens, they check you for scoliosis, and they say if scoliosis is bad enough, it can actually affect your health for how long? Forever, actually. So they say, not because someone's in pain, because if there's pressure on the nervous system, that's what causes dysfunction or dis-ease of the body, meaning an imbalance in the body. For how long? For years, right? And so what happens is that if someone has scoliosis, guess what their body has to start doing from even a young age? It has to start to what? Compensate. Compensate. And so how does compensation, what does compensation lead to? Potentials for other issues to occur in posture, right? Now, we know our hips have to be even, our spine has to be straight, shoulders have to be straight, and from the side we have to have 3 45-degree curves. Most people don't realize this, right? So from the side, we have to have these curves, just like this poster shows, right? Starting at the neck, it has to be in a 45-degree curve. It's called the arc of life. This is not Dr. Nick language, this is medical language. They've actually coined it as the arc of life. Why? Because life flows from the brain through the spinal cord all the way down and all the way back up. And if there's issues in the neck, let's say the head is too far forward or the curve's been lost over time, that leaves us prone to not only falls, but a whole host of other health issues, right? And when do we, this is crazy, when do we actually have our neck, when can it be affected in our life? What's the first time it can be affected? Birth. Exactly. Right? Where the baby's born, right? And the doctors can, pull the head and neck up to 80 pounds of pressure on the head or neck. Not because the doctor's bad, because they want to get the baby what? Out, right? And so what happens is they pull on the neck, there can be pressure in the neck or stress in the neck from birth. And now we live our life with that issue for how long? For years, right? And then we throw in falls, sports, car accidents, how we sit, all these things along the way, right? And so what happens is that if there's issues in the structure of the spine, that leads to issues in the function of the spine. Does that make sense? So structure, healthy structure leads to healthy function, leads to a healthy posture and healthy body, right? If we have a bad structure, or poor structure, or damaged structure from years of use starting from birth, that leads to a dysfunction, meaning it's not functioning 100%, therefore leads to other issues, poor posture, potentially sickness, symptoms along the way. And so we need to, we have to try to achieve these three curves. And is it hard to achieve really at any age of adulthood? Yeah, I would say it's hard to achieve, right? Because we can lose it as a kid, right? But we have to be able to gain it over time, right? And so we have to make sure these three curves are there for organ function. So specifically, the nerves in the neck, they affect the lungs, they affect the heart, it affects your mood, energy levels, sleep patterns, even the immune system comes from the cervical spine, comes from the neck. The mid-back starts to impact the pancreas, the spleen, the stomach, the upper GI system. So we're talking, this is blood sugar, this is kidneys as well. The lower back affects everything from the stomach down, so lower colon, prostate for men, bladder, women reproductive organs. All the issues in our abdomen can also be from our lower back, believe it or not. Most people have never made that connection. And then also, of course, when you think about sciatica or pain on the leg, it doesn't start in the leg. Where does that start? In your back, right? It starts in your back, right? Numbness and tingling in our arms and our hands. Where does that start? In our what? Neck. It starts in our neck. Most people will recognize that, but they don't really know what to do about it. So we do a lot of things in our culture to try to chase the pain away, don't we? When someone has pain, what do most people try to do first? Ask for that. Some really stubborn people would ignore it. You know someone like that. Just ignore the pain for years. No one's stubborn here? Alright? So people ignore the pain. They say, oh, I'm just fine, I'll just deal with it, I'm strong, right? Until it slows us down and they take a what? An aspirin, like you said, or ibuprofen or whatever it is, because why? It's just easier to mask the pain and live life, right? I'm not saying you should suffer, but what we do is when we do something to hide the pain day in, day out, then of course affects us down the road, right? So for us, and for what you guys need to be doing is like, what can we do posturally that's going to impact the function of our body? As I said, opening up your diaphragm, making sure you elongate your abdomen, bringing your shoulders back, bringing your head back over the shoulders, having that 15-degree look towards the sky. This is all important, and not just make you healthy, but of course, making sure that your posture is good so that you don't have any type of issues with falling. Now, raise your hand if you ever heard of mechanoreception. Anyone heard of mechanoreception? Okay. This is an input that happens in the brain with movement and touch. Okay. Who knows it's important to have physical touch? Everyone know that? Not just to be loved, but just that physical touch is so important, right? Also, who knows it's important to move? Raise your hand who knows it's important to move, right? We all know that, right? So what happens when we move, right, and or we have physical touch, what happens is it stimulates our brain in a positive way. Happy hormones occur, endorphins are released, dopamine and serotonin skyrocket, and so when serotonin and dopamine are released in the body, those are our happy hormones, right? What happens to our breathing? Does it speed up and become shallow, or do you think it slows down and becomes more relaxed? Slows down, actually, it becomes more relaxed with movement and touch. Right? So believe it or not, movement and touch, even just walking, right, and more physical contact we have with people, the less likely of us actually falling. Research has actually proven it, believe it or not. The less likely of us falling, and if we do fall, it's even more important, the better we will recover. Does that make sense? We might not be able to avoid every fall, right? But if we can focus on not just avoiding the fall, but if we do fall or get sick or whatever the case may be, let's recover faster too. So what should we all be doing? We should be walking every single day in the best posture we possibly can be. And also we should be focusing on physical touch, so whatever that is, whether it's a handshake or a hug, or if you have grandkids, it's pretty easy, they'll jump all over you, right? So physical touch is not just a want, it's a necessity, okay? Now another thing we have to do is we have to focus on our eye movements. This is really important, okay? This is stuff we learned as a kid, but what happens, as I said earlier, as an adult, we start to lose those things we once gained. Because we're never challenged, right? You can't grow until you're challenged. And so we have to now be conscious of what we're doing with our eyes. So this is why is reading so important. Not just so you can stimulate your brain and memory, but even eye movement has been shown to focus on better posture, to focus on prevention of falls, right? And we got to focus on tracking with our eyes. Tracking with our eyes. So one of the simple things that I teach my patients is even taking a pen and following the pen with your eyes without moving your head in all different directions. Okay? Now it's not a DWI test or anything like that, right? But it does let you know, like, okay, are my eyes tracking well? And this is a really test. Have someone do it to you, right? And see if you can not move your head. See if you can not move your head. And making sure your eyes are smooth moving, not jumping. Does that make sense? Right? Because if they're jumping, that means is that there's not necessarily a disconnect in the brain, but there could be an interference of something that's going on, right? So then we're going to focus on eye movements, okay? Eye movements. Eye-hand coordination also kind of goes with mechanoreception or touch, but even if you take a tennis ball or a racquetball or any type of ball, and just you throw the ball up and down, even in one hand, and you're catching it like that, that focuses on the reflexes that attach to your brain, which then causes you to be able to respond to your environment better, right? This is why I like some of the times those squeeze balls, if someone can't throw the ball up and catch, I like those stress balls, because what happens is that if you're squeezing that, you're still stimulating.
Could you say that again?
Seriously wrong. Then what happens is that you can actually stimulate your brain in that way too, because you stimulate mechanoreception too. And once again, it makes you more open to your environment. Who's ever heard of light therapy? Right, this kind of goes along with visual therapy, okay? So changing in colors, changing in lights. The best type of light therapy we have that's natural is the day. How the sun goes up and how the what? The sun goes down, right? And being outside or being exposed to sunlight as much as we can is the best form of natural light therapy we can ever have. And guess what that does? It stimulates our brain to make us better responsive to our environment. That's what it's about. How do we become more responsive to our environment? Okay? Also, writing. Writing, who still writes letters? That's awesome. Yeah. That's right. So writing letters has been also shown to really stimulate our brain and make us more effective in how we adapt to our environment. Even walking down the stairs or up the stairs, writing your letters actually helps your brain adapt to even walking. Isn't that crazy? So we need to actually using our hands and writing things, right? Coloring. Who colors in here? Who has the color? That's awesome. So coloring also focuses on not necessarily light therapy, but color therapy for your eyes. And also it focuses you on the lines, right? And of course it stimulates that artistic side of your brain. Once again, having an artistic side of the brain takes work for some of us, myself included, but it actually helps us adapt to our environment better. And once again, prevent future falls and prevent us from not being able to recover from future falls. And that sounds crazy, but it's a fact, right? And so we're taking into account with our eyes, we're taking into account what we're doing with our hands, how we're moving, how we're sitting, how we're walking, how we're exercising. Who exercises in here every day? Raise your hand if you exercise every single day. That is incredible. I love it. Movement every day is absolutely vital for our body, vital for our health. And one of the things I would encourage you to do, I don't know what kind of access you have to equipment here or gym equipment, but one of the things I recommend all my patients do at any age is to be walking 40 to 60 minutes a day. 40 to 60 minutes a day is like absolute necessity. Why? This is really important. Because what research shows around 40 to 60 minutes, depending on the gender, depending on the age of the patient, is that what happens is that it starts to stimulate your quads, the muscles in the front of your leg, so much so that it actually fires to your brain and it enhances your frontal lobe. Right? Frontal lobe is your decision making, it's your empathy, it's your sympathy, it's your environment, it's your personality, it's your ability to laugh, it's your ability to cry, it's the frontal lobe. If someone's frontal lobe isn't working, they're not the best person, right? You want to stay away from them. So walking actually 40 to 60 minutes a day actually stimulates your frontal lobe, which then stimulates your what? Mood, which then brings down the stress hormone called cortisol, right? And all your happy hormones are firing, right? But there's something about that 40 to 60 minutes time frame that they did on all different age ranges and all different genders, okay? Less than that is better than nothing, so don't discount that. But if we're going for a 30-minute walk, just walk those extra 15 minutes, and you're going to tell a huge difference in mood. You're going to tell a huge difference in your body's ability to adapt to its environment. And once again, you're walking upright, that's going to be awesome for you. It's going to be awesome for you. So all these are sensory things that we can be doing in our health and our body that's going to impact how we can adapt to our environment. Okay. Now, the eye track we talked about color, we talked about eye-hand coordination, talked about posture. You know, one of the things that I would also encourage you to do is make sure you change up what you're listening to. Raise your hand if you listen to music. Okay. So raise your hand if you change up the music a lot. You like to listen to all types of music. All types of music. Okay. So one of the things that's also been shown to actually help us and help stimulate our brain to keep us from ever, not be able to deal with our environment is music. Not just playing music though, because I was always like, well, that's not me. I can't play piano, I can't play guitar, I can't play anything. Playing music, side note, is incredible for your brain and keeps you from any potential falls. But I would argue that even listening to music is really important as well, right? So listening to different types of music, listening to different types of sounds. Where's the best type of nature sounds we can get? Is outside. You guys with me on that? Yeah, from nature, right? Whether it's the rain, whether it's sleet, whether it's watching the snow fall down and hearing it hit the window. All those things actually stimulate our brain and keep us from ever becoming weak and having the potential to fall. I know it sounds crazy, right? But if we start to strengthen our brain, it strengthens everything. The strength of our brain and the ability for our brain to adapt to the environment, we take things in, right, allows us to affects us physically as well. Most people don't make that connection, but you can make that connection. You can change your ability to stay strong on your feet and your legs and be stable by not even having to move. You can affect that, right? Why are crossword puzzles great? It stimulates your brain, right? Why are puzzles great? It's stimulating your brain. It's an eye-hand visual connection, right? So all of those things are so important. And guess what? All these things I'm telling you guys to do, that's what I'm teaching my kids to do. Does that make sense? So we do it naturally as a kid because we just want to learn how to put a puzzle together. We want to color something that we learned to have in school, right? But what happens is as an adult, for some reason, we feel like we got that in the bag, right? It's like when we say, like, you never forgot to ride a bike, right? Some of us haven't done a bike in a long time, right? Right? And it'd be like, oh my, I don't know if I get on a bike right now, right? So same thing, that we may not forget how to color or forget how to listen to music or maybe, squeeze a stress ball or walk straight up or walk on a treadmill, whatever it is. But we just don't do enough of it. And if you don't do it, you what? Lose it. That's exactly right. It's exactly right. And so there's no really silver bullet, honestly. It's all of those things continuing to work and being, I would say, intentional about it and apply it to your life on a daily basis. Because you guys know the days can go fast. The days can go quick. You're like, well, I didn't do anything opposite we did for today, right? And so how can we impact our stimulation of our brain is going to affect us, not just for tomorrow, but way down the road. Way down the road. And I think it starts with, like I said, being intentional about the actions you're going to take and what that looks like for you. And I would say challenging your posture, challenging your distance of walking, the ability to stand longer. What does that look like for you? For some people, it might be hard to stand, so maybe they're standing for 10 minutes at a time. Some people are like, I can stand all day, I can walk all day. But how do we push that to the next level? So if you're a walker already, 45 to 40, 60 minutes a day, that's great. The next level would be to increase the treadmill about 1 degree. You're not going high on a runway, but even just increasing it just slightly challenges your body, stimulates those muscles more, and helps stimulate the brain. So what I would encourage you guys to do is, what are those things that you may have done in the past that you kind of let go to the wayside, right? Raise your hand. I'm not going to be sharing, but raise your hand if you have something in mind. Like, I should start to do that again when I used to do that. Raise your hand. Puzzles, music, physical touch, contact, all those things, right? Who has a good example of something that they do on a daily basis that they just feel like their brain stimulates their brain? Anyone have any examples? Yes.
I try to walk 2 miles outside if possible.
Ah, that's awesome.
It helps me to hear just the nature.
Yeah, I love that. Yes, ma'am. Did you bring it too? Yeah.
I play piano.
That's amazing. Yeah, that's great. That's awesome. And another thing too about walking outside is just the fresh air, right? We just don't get enough fresh air now. Even kids don't get enough fresh air now. We're not outside enough. And so those are both awesome examples. And when it comes to different specific physical exercises that we can do to strengthen our body and strengthen our legs. I mean, once again, it's not about strength, it's about stability. So stability leads to strength. What also leads to stability, though, is range of motion. So we have to have good range of motion in our joints the best that we can to have proper stability, to have proper range of motion. So, when you're getting out of the chair, try your best to not push on the hand, push on the armrest. Most people, we just push on the armrest, we don't use our legs, we just kind of lean forward and get out. So one of the things you can start to do is just go from a seated position in a chair and try to stand up without pushing on the armrest. Okay, at first it may be challenging, right? But if we're just intentional about that, then it strengthens our hips, it strengthens our legs, and what also does, it forces our eyes to stay parallel to the ground. So we're not like this. Like some people get up like this when they're looking down. What does that? That leads to potential fall risk down the road, right? Because when they're up, the first thing to do is they look down, which means gravity is going to win every time. So if we're focused on being in that parallel posture, parallel position, that's going to affect everything. Does that make sense? Okay. So I know we went over a lot of things there. We've got about 10 minutes left or so. So I wanted to share with you guys just kind of the health journey that I've been on over the last 15 years. So you kind of know, like, no matter where you are with your health, you can always improve, right? The same miracle that's in a newborn baby is in a 95-year-old's body, right? We may not think we're miracles at 95, right? We may not feel like a miracle, right? But that same miracle in a newborn baby is still in you until the day you die. But what happens, we think our culture teaches us that we just lose that luster, right? We lose that sparkle, right? We just say we're like everybody else and we're not going to be any different. So I'm here to encourage you that I was one of those kids that really, I was a miracle, but I was sick from birth. I mean, I had chronic ear infections, digestive issues, skin problems. I was a mess, right? I grew up in the whole, you got a fever, take a pill. If you're uncomfortable at all, Nick, take a pill. If you have heartburn, which I did, just take some antacids so you don't feel it. I know some people who come to my office who, they think preventative medicine is actually taking Tums or antacids before they have barbecue that weekend. Who knows someone like that? Well, I'm going to be preventative with, this is wellness. This is wellness. I'm taking my Tums before I eat. Can you imagine that? Right? Listen, guys, if there's something wrong in the stomach, it's yelling at you something is wrong, and we're just shutting it down. So symptoms can be a good thing if we listen. So if we're imbalanced when we stand, or it's hard for us to get up, or we're dizzy, or we can't stand on one foot, or we can't throw the ball from one hand to the other, it's not a crisis mode. But what we can't do is we can't ignore it. Right? We can't ignore these things that we should be able to do. Because when we ignore these things we should do, or I should say not ignore, we accept these things just because of our what? Age and or genes. Are we going to get better or worse if we just accept something? It's going to get worse, right? Unless we're growing in the right direction intentionally, we're going to keep going in the wrong direction, right? Unintentionally, right? And so that was me as a kid. That was me as a young adult. At 23 years old, a chiropractor said, listen, there's something wrong with your spine. That's what's affecting every organ function of your body. I go, there's no way. You have to be lying. Because I know, I grew up down the street from Logan College. I heard chiropractors are quacks. Who's ever heard that? Anyone heard that term? I know. It's crazy. So I heard that chiropractors are quacks. Now, my mom always said this. Once again, she's a medical nurse, ICU nurse. She said that chiropractors are quacks, but if you ever get in a car accident, they're really good for that. We've never heard that statement before, right? Or if you have neck pain, they're probably good for what? Neck pain, maybe, right? But only if they take your insurance. Who's ever heard that before too, right? And so what I said to this chiropractor, I go, man, I don't have neck pain, I don't have headaches, I don't have back pain. I look pretty healthy, I'm taking all these great supplements, my nutrition is probably better than yours. He goes, but has anyone ever looked at your neck? And I go, what do you mean? My neck looks pretty good, I'm 23 years old. He goes, no, has anyone looked at your neck on x-rays? I go, no one's looked at my neck on x-rays. He goes, well, come to the office, I'll see what your spine looks like, and we'll see if this is affecting every human body, right? Every human body. And so I went to the office, I got x-rays out of my neck. As I said earlier, it should be at a 45-degree curve in the shape of a C. Mine was at 0 degrees at the age of 23 years old. I lost 100% of the curve of my neck at 23 years old, and I didn't have neck pain. Can you imagine that? Right? But those same nerves branching out of my neck went to my lungs, causing me to have asthma, went to my stomach and esophagus, causing me to have acid reflux, went to my eyes, ears, nose, and throat, and that's when I realized that it's not St. Louis's fault that I've had allergies year-round, right? Because allergies year-round is not seasonal allergies. You guys with me on that? That's all seasons allergies, okay? So if you just take an allergy pill every morning, we should probably question that, right? We should probably question why am I doing this every single day? For how long? Ever, usually, right? Because we live in St. Louis. I think we should question that a little more, right? And so I got questioned. I go, hey, I don't know why, I thought I was healthy. He goes, well, something happened to you. I go, not really. So I call my mom, Mom, what happened to me? Like, I fall downstairs as a kid, this is crazy, my neck's really bad. She goes, Nick, you were a 10+ pound baby from birth, and the doctor said to pull on your head for 2 hours, you were stuck in the canal, they didn't nearly dislocate your shoulder, and there was trauma from birth. She goes, wait, is the chiropractor saying that there's damage to your neck from birth, or damage to your neck at all over time? That's what's causing you organ issues. I go, yeah, how'd you know that? She goes, because in ICU nursing, meaning serious nursing and recovery, and especially with car accidents, they're taught that if there's trauma to the neck area, the lungs will have an issue, the stomach will have an issue, and the immune system will have an issue. She's taught in trauma that can cause acute issues, but they're not taught in chronic stress in the nervous system can cause chronic issues over time, like I had. They're not taught that, right? And so to make the connection is powerful. And so I said, listen, what else, Mom? She goes, well, you did have 4 concussions in hockey. I was a big hockey, football, baseball guy. I go, man, I don't remember those concussions. They were pretty good. She goes, well, what's crazy is we brought you to the ER, we brought you to urgent care, and they scanned your brain. They MRI'd your brain, but they never actually looked at your neck because you weren't in what? Pain. Think about that. So we should question what we're looking for and why we're looking for it. And so I started getting my spine corrected based off of getting my posture better, getting pressure off the nervous system. And within, I kid you not, within 2 months, once again, I was 23 years old, but within 2 months I got off 7 medications. In 2 months I got off my asthma medication, allergy medication, stomach issue medication, and antibiotic medication. After being on it for 20 years at that point. For 20 years. And so I was like, maybe chiropractors aren't quacks like that as I thought, right? Maybe it's actually about function and our ability to adapt to our environment more than just pain and symptoms and sicknesses and disease, right? So when do we adjust people in our office? At what age do you think? Babies. Yeah, go to hospitals and adjust babies. We have women, moms bring their, families bring their newborn babies in the office. Now, adjusting a baby is different than an adult, right? Right? But think about that. There's pressure on the spine. When's the best time to get it off? Right away, right? So all the things I talked about with you earlier are all about external things that impact your ability to stand, walk, get stronger, avoid falling, all those sensory perception things that we need to do, right? We all need that. But we also need internal balance too, to have that mirroring that, right? With that internal balance too, to make sure that we're doing all we can, but we're not stooped over, we're not falling over. You're not like me, have 0 degree curve in your neck at the age of 23, right? And so I think it's important for us to know that the most amazing healing potential never leaves your body, it's already within you. It is your central nervous system, and all those things I talked about that you can do right now, starting today, stimulates your central nervous system from the outside. Well, chiropractic, why I know so much about all this stuff, all the things we talked about, is because when people get adjusted and their spine is in proper position, it stimulates that from the inside. Right? So I would say the body needs no help to heal, it just needs no interference. So whether that's interference externally, what we're doing to our body, what we're not doing to our body, what we're ignoring, or what's happening on the inside. And so I just wanted to encourage you guys that miracle that's inside you from birth is still there. It's still there. We gotta get our spark back a little bit, we gotta get our color back, we gotta get lively again, because if we don't, we all start to dull out like everybody else. This is not an age thing, this is just a fact. And by the way, your generation, I think, is healthier than most teenagers. I'm just telling you guys that right now. That's not a joke. I have generations of people in my clinic where the grandmother is healthier than the 10-year-old. No, great-grandmothers are healthier than their teenagers. This is not a joke. And why? It's because as kids, you guys were forced to do all the things we just talked about. To learn how to play music, to go outside for a walk, to throw a ball, to color, right? All those things that you were forced to learn because that's all you had to do. Kids that are being stripped from that right now. They don't have to do that because they have iPads, they have phones, they have the posture worse than their grandparents, right? And so I would consider your generation awesomely blessed and lucky because I really truly believe you guys are healthier than the next one's coming up, unfortunately, right, for them, right? And so if you have grandkids, they need to be doing the things that you do. I know it sounds crazy, but you all learn there's a circle of life, right? There's a circle of life. And the things that we were once had to do, we must do now, right? We must do now to keep our body right, to keep our head right, to keep our balance right. All those things are important. So I want to leave a couple minutes for questions. So any questions for me at all about health, about some of the sensory things we talked about, posture, strengthening things, nutrition? I'll answer anything. Go ahead. Yes, sir.
I have the dizziness and feeling of vertigo, and I think it's because of the medicines I take.
Yeah.
So, could I ask the doctor to prove that I need to take those medicines? I've been taking them a long time.
Yeah. Yeah, so if I'm you, because I can't talk to you like a doctor, I can talk to you like family, if that's cool. So I would just ask more questions. I would ask more questions of the doctor saying, hey, I'm doing a lot of things right, but I can't get rid of this vertigo. I believe it's from the medication use. What do you think? Can we have a game plan? Can we have an action to reduce and or? That's what they want to hear. They want to hear reduce and or have the goal of removing these medications for the long haul. Right? Because if you go on there saying, this medication is causing me vertigo, take those medications, that's probably what I would do, right? Then they're not going to listen. But if you have a good doctor, then they'll listen to that conversation, right? Just leave it open-ended, let them listen to that, and they'll start to reduce that medication. Because unfortunately, they're seeing more and more of that, right? Symptoms that are chronic, that are caused by
It's not reducing it, they want you to take more.
That's right. Because people don't know to ask the right questions and how to ask the questions. So it's not just what to say, it's how to actually look at your doctor as part of your team. If you don't feel like they're on your team to be medication-free eventually, or reduce the medication as much as possible, or whatever, be as healthy as possible, then I think it's time to get a new doctor. And you'll feel it in your gut and your heart, you know. So, any other questions? Yeah.
I think it's really cool. I go into the clinic and they're treating babies and children. And when I was doing physical therapy for babies and little ones, the doctors, the MDs would say, oh, you can't do anything with their neck. And they're doing it, and it's real cool.
Yeah, that's awesome. Thank you.
Have they done anything to prevent damage to the apex of babies?
Yeah, they really, their initial response was more C-sections. Well, they found out that C-sections aren't as good for a baby as they once thought, because we should go through the canal for that compression of our lungs, and it leads to that extreme expansion. What they found in C-sections actually led to more potential for asthma risks, for RSV for kids. And so it was definitely a Band-Aid response, a knee-jerk response to it. Let's just create no pressure on the child. Well, no pressure or challenge is also not a good thing either. Right? So really, to avoid the pressure on the baby's neck and the baby, the mom just has to really take care of her health and do a lot of things before the birth. So. But I would say that the day in, day out of chronic use of our spine and how we look at our phone, or how we're reading, or how we fall asleep in a chair, you know, all those things are the things that really cause the most damage over time, because they become so chronic in nature versus an acute response, whether it's birth or a car accident, a fall. And so looking at those things that you did in your life and for a career chronically that have maybe contributed to where you are today posturally, and those are the things that we got to contribute, because it's not usually just one thing that causes everything, it's accumulation of everything that causes everything. And if anyone's interested in coming to the office and just seeing what your spine looks like, sometimes people say, well, I have shoulder pain, or I have sciatica, or I have whatever symptom that you have, or I do feel imbalanced or dizzy. I wonder if there's something going on in my spine. I don't usually ask me that question. So usually how it works is that we just do a discounted exam, which includes x-rays, and so that way we see everything that's going on in the body, and then we do a follow-up appointment where we go over everything with you, so you see everything too. So you have actually sit down and go over your specific x-rays, the specific markings. Most people ask about, well, what about Medicare, what about insurance? Everyone's coverage is so different. We know chiropractic is not awesome coverage, because they don't cover exams, so that's why we do the discounted exam from the get-go, and we'll go over any financial questions, insurance questions at the second appointment before you spend another dime. But that way you know, can they help me? Is there something going on with my spine? And how do we do that going forward? Why do I do that? Because that's what the doctor did for me, right? Instead of spending $200 to go get x-rays, he did it at a discounted rate, and thank goodness I did it as a college student, because I would have never, you know what my spine looked like, I would have never gotten the root cause of my problems, and I would have just been guessing for the rest of my life. I truly believe that. Yes, ma'am.
I'm just very impressed with the information you have given us today.
Thank you.
About how the whole body is so effective with everything. And instead of just going in for an adjustment, you do the whole body.
Yeah.
And that's very important.
Yeah. Well, thank you. I appreciate that. Yeah, and I think it's information that's so simple. Like, the principles are simple. The application is challenging, right? Because we're just in a world that's not there, I think. But I think if we get back to the basics and the foundations, and we just become more intentional about asking the right questions, then I think we can really take back control of our health. And more so taking control and take responsibility, which I think is even more powerful, right? Because the power of choice is in your hands, not in the doctor's hands, not in my hands, but it's in your hands. And that's really something you gotta hold on to. Okay? Any other questions about anything? Oh. Good. All right, great. Thank you so much for having me. Appreciate you guys.